Well, as colder months move in and questions surrounding vaccine availability grow, the health secretary is now facing widespread criticism, even some calls to step down. So falling vaccination rates have led to a number of outbreaks this year, from the measles in Texas now to whooping cough in Louisiana. Republican Senator Bill Cassidy has called on the health secretary to publicly support the whooping cough vaccine as the state is experiencing one of its worst outbreaks in recent decades. With us now, Dr. Frita Fisher, leading medical voice in nephrology, internal medicine, pediatrics, and obesity medicine. Dr. Frita, good morning to you.
Good morning.
So the CDC is continuing to cite these falling vaccination rates among children in particular, as you know. What do you attribute to the hesitancy surrounding vaccines that have been around for years, like the vaccine for whooping cough? And what do you see as the greatest impacts as well?
Well, for years, we've known that vaccines against whooping cough, diphtheria, pertussis, polio have worked. We know that they've saved lives. In fact, according to some peer-reviewed studies, vaccines have saved over 150 million lives and reduced infant mortality by 40% over the last 50 years. There's really been no controversy about many vaccines. Even President Trump said the same. But now, with all of the misinformation, it's leaving people confused. And when people are confused, they tend to do nothing. And doing nothing would mean getting less vaccines, which will decrease the protection against preventable diseases and cause us to have an increase in diseases like whooping cough and measles, which we are clearly seeing now.
So there's a lot of uncertainty at this hour around COVID-19 vaccines. Are you anticipating any shortages given RFK's recent cancellations of those COVID contracts? What do you believe the rollout may look like in the days ahead?
Absolutely. Beyond us knowing that RFK Jr. supports decreasing the research in messenger RNA vaccines, he's also changed the recommendations to only people who are over 65 or with known chronic diseases. Well, already I've gone into my local pharmacies just to do a bit of questioning and asking, for my patients. And I found out that if you don't have prescriptions, then you won't be allowed to get the COVID-19 vaccine. So then if you are someone who is a pregnant woman, if you are a young child between the ages of 6 months and 23 months, we know that the American Academy of Pediatrics recommends vaccines for children less than 2 against COVID because of the complications. Well, now without a prescription, you won't be able to get it, which will most definitely decrease the uptake. And we know that already COVID-19 is here and it still does cause death. And so it's really important to have access.
The health secretary, he's rolling out his chronic health report as well, and he's highlighting this need to improve children's nutrition, food labeling. In your professional opinion, is nutrition a key factor in many underlying chronic illnesses among children as well?
Absolutely. Having great nutrition is essential to having great health. So when children are eating high ultra-processed foods that are high in salts, high in carbohydrates, then it will increase their risk for chronic diseases. Here's the issue. In order to have healthy foods, you must have access. The current administration is implementing cuts to SNAP benefits. And so then people in rural areas or people with low income will not be able to afford these whole foods and healthy foods. Also, there have been some proposals to not allow low income families to use their SNAP benefits to buy unhealthy foods. That would be great if they had an alternative. But if you cannot afford the less expensive ultra-processed foods, if that's the only thing you can afford, and now you can't buy them with your benefits, plus you cannot afford healthy whole foods, then we're going to lead to a decreased nutrition, which will not make America healthy. It will make America hungry and with more chronic diseases.
Yeah, there have been quite a few heated debates about what the impacts of those changes will be. Dr. Frita, always great to get your perspective. Appreciate your voice. Thank you.
My pleasure.